there are risk factors which are involved in heart disease. For example, diabetes, high blood pressure, high cholesterol, smoking, which is very common among Singaporeans, and lack of exercise, stress, which of course I did not tell you, stress is very common among the Singaporeans. So these are all constitute risk factors for developing heart disease. And also you have sometimes ethnicity, which are the Indians are more common, age or aging population, as well as people who are more prone to heart disease than the female, 5:1 ratio. So these are the risk factors. And coming to the Indians are having the highest number of diabetes among the ratio among the population in Singapore. As I said before, diabetes is a very important cause for heart disease, and since they have a high incidence of diabetes, so it is common for them to get heart disease. The other thing is cholesterol. Cholesterol is also very important because LDL cholesterol is a bad cholesterol. HDL cholesterol is the good cholesterol. The HDL cholesterol, which is quite commonly seen, most of the people are normal, but if you see Indians, a lot of Indians have very low HDL cholesterol. This may be due to lack of exercise. The only way to improve your HDL cholesterol is by exercising, but hardly many Indians exercise. That's maybe one of the reasons. All sedentary, working very hard. The condition is called a metabolic syndrome. It's comprises of a group of symptoms. First important thing is, I should say, is the obesity. People are very obese, which is truncal obesity, because the stomach and the waist is very thick and are heavy, and they also have high triglyceride levels, low LDL, good cholesterol, that's the HDL levels. They are smoking and lack of exercise and sedentary. These are all combinations of metabolic syndrome, which will, along with diabetes or low intolerance in glucose, will lead to heart disease. So in general, the above said reason, the metabolic syndrome as well as lack of exercise, low HDL cholesterol, may explain why the ethnic Indians have high incidence of heart disease. And hence, in order to at least to put a break or even to reverse this condition, people should be aware of the conditions which are there, and therefore if you all the ones I said, all the risk factors, if they can cut down all the risk factors, and then they can minimize the incidence of heart disease, which is very important. Cut down the salt intake, reduce sugar intake, exercise regularly, keep the body weight, very important, body weight, go to gym, exercise, and of course if you do all this, your incidence of heart disease, getting heart disease will be surely reduced.